Hi, today we'd like to share some very important instructions about care after your ACL knee surgery. Understanding and following these simple instructions is important to a good recovery. We hope this informational video will help you feel more confident and get you back to your usual activities without pain. Now, I'll pass it over to my colleague Dave, who will explain some of the details of this surgery and how this may impact your activity immediately following surgery.
Thanks, John. Today, I'm going to share important instructions for after surgery, as well as demonstrate some of the best practices in support of your ACL surgery. Your surgeon likely talked with you on the best surgical graft choice in the reconstruction of your ACL. This decision is carefully made based on the different activities you may take part in. Often, this may include your patellar, hamstring, or quadricep tendon. For other patients, an allograft is sometimes used from a cadaver or donor to assist in reconstructing your ACL. This graft choice doesn't have an impact on your ability to return to activity, but it is important to note that if you have a patellar tendon graft, you may have slightly increased anterior or front knee pain. While if you have a hamstring or quadricep tendon graft, you may have an extended period of weakness in these muscles as you're returning to activities. At your initial physical therapy appointment, you will review the following information. If you had a meniscus repair in addition to your ACL reconstruction, you will be non-weight bearing on your surgical leg for a period of 6 weeks. If you did not have an additional meniscus repair, you will be able to weight bear as much as you can tolerate immediately following surgery. Your physical therapist will confirm with you on the first day of rehabilitation your weight-bearing status if you are unsure. Next, it's important to understand your knee's incisions. Let's take a brief look at the incisions on the anterior or front of your knee following ACL surgery. These small cuts are named portal incisions and are often covered by a yellow material named Xeroform with underlying stitches. These help to keep the incision dry and protected. It is important that during the first 2 weeks when these stitches are in, that the anterior or front of your knee is kept dry, which includes limiting how much you are sweating and taking steps to reduce or limit any wetness from showering to this part of your leg. At your 2-week follow-up appointment in your surgeon's office, you will have these stitches removed. From there, you will be able to get these incisions wet, though you should continue not to soak your knee in water for several weeks. Next, this vertical incision is where your new graft for your ACL reconstruction was harvested. This longer incision has glue over top of it, and while there is no yellow dressing, you must also keep this area dry for the same period as previously described. It's important to cover these incisions with gauze squares provided to protect the incision site and an overlying ACE bandage, which can assist with swelling management and to keep the gauze squares in place. Keep the bandages from surgery on until your physical therapy appointment the day after surgery. After that appointment, you can change the bandages daily. If you don't have a physical therapy appointment immediately after surgery, please remove these bandages on your own after 72 hours. You can shower 72 hours after surgery, but avoid soaking your leg, scrubbing the incisions, or putting lotion or ointment on them. For the first 2 weeks, keep the incisions dry and don't irritate them. You might see small yellow strips on the incisions called Xeroform. Don't remove them. They might fall off on their own after a week. Now, I'd like to share some information about pain medication and management. Take the medicine exactly as your care team has instructed you. If you have questions about medicine, contact your doctor's office or use MyChart to communicate with the care team. Ice your anterior or front of your knee several times a day, especially after performing therapy exercises. Ice for 15 to 20 minutes at a time, and then take a break for at least an hour to prevent too much inflammation and swelling. Now, I'll hand it back to my colleague John to talk about the initial exercises you will perform at home and with your physical therapist.
Thanks, Dave. After surgery, it's important to begin performing exercises to address several issues that will be present. These include the management of swelling and inflammation, restoring knee range of motion, quadricep muscle recruitment and activation, and weight bearing and walking if able to. For swelling and inflammation management, it's important to not only use the ice provided after surgery, but also to perform some specific exercises and positions to reduce the likelihood of significant swelling from developing further. One exercise to perform immediately will be ankle pumps. These can be performed sitting in bed or on the couch. It's important that your legs are straight and to always keep the brace on your knee locked straight into extension. From here, you can bring your ankle pointed up towards you and then point your ankle away from you. These can be performed back and forth for at least 1 minute. This exercise will assist in increasing blood flow in your legs since you may be more still after surgery. When resting at home, it's very important to keep the brace on your knee locked straight into extension. In this position, we encourage you to elevate your entire surgical leg, not just underneath your knee or your ankle. The entire leg should be elevated on a pillow. This will reduce swelling without interfering with knee extension. One of the most important factors following ACL surgery is restoring knee range of motion. If you had a meniscus repair in addition to having your ACL surgery, your physical therapist may slightly restrict how much range of motion you will be allowed to have. Otherwise, your therapist will quickly work to restore range of motion in both flexion or bending, as well as extension or straightening. At home, you can work on this range of motion as well. One exercise you can perform at home will be heel slides. These can be performed sitting in bed or while lying on the couch. During this exercise, it may be easiest to place a bedsheet, strap, or larger towel around the backside of your foot. From here, you can use your arms to pull the strap towards yourself, causing your knee to bend. It's important to gently pull towards you, bending your knee until you feel a slight stretch and minor discomfort. If the stretch feels sharp or painful, work slowly to slide your foot back to its original position and try not to push through this pain. After surgery, because of swelling and inflammation in your knee, it's common for your quadricep or thigh muscles to not be able to activate as well as you would like to immediately after surgery. This may be because of the nerve block placed during the surgery, though after this brief period of about 24 hours, the swelling present in the knee will be the main limitation to quadricep muscle control. Some basic exercises following surgery can assist in activating your thigh muscles. An exercise you can try at home is called a quadricep set. It works to perform a very basic muscle activation of the quadricep or thigh muscle. While lying in bed or sitting upright in bed, place a towel roll directly underneath your surgical knee. From there, work to straighten out your knee as if you were trying to flatten the towel. Hold this position for a period of 5 seconds, at which point you can rest. This movement may feel stiff or uncomfortable, though it shouldn't feel sharp or painful. This exercise, in addition to improving your quadricep activation, can also assist in knee extension range of motion. Another exercise you can perform lying on your back will be a gluteal set. From here, work to squeeze your buttock muscles together and hold it for 5 seconds. Lastly, you will perform a straight leg raise. While lying in bed or sitting upright, you will perform a quadricep set with a towel under your knee. Next, while pointing your ankle towards you, you will attempt to lift your entire surgical leg upwards off the bed as one unit, approximately 6 inches off the table. This exercise may be the most challenging, though it's important that you are able to perform this movement within the first 2 weeks following surgery.
Thanks, John. After surgery, you might be in more pain than usual. This is normal, so take your pain medication as prescribed and use ice often. While each ACL surgery can be slightly different based on the extent and type of surgery, as well as your weight-bearing status, there are some standard expectations after surgery that you should know and consider. It's important to talk with your physical therapist during your first appointment so that you can better understand the details of your surgery. You'll need to always wear your hinged brace on your surgical knee, except for showering and when performing your physical therapy exercises. You can expect to wear the brace for at least 6 weeks. If the brace is on your right leg, you will likely not be able to drive for at least these first 6 weeks, and perhaps even longer. It's important to note that if you are taking prescribed pain medication, you should not be driving, regardless of how far after surgery you are. The brace should be worn and locked in full extension and should be continually adjusted by your physical therapist as the level of swelling in your surgical knee decreases over time. If you are having any discomfort from the brace, please let your therapist know so that changes can be made. Depending on the type of surgery you have, you may be able to walk immediately as much as you can tolerate. If you had any meniscus repair during your surgery, you will not be allowed to walk for the first 6 weeks. It should also be noted that if you had the meniscus repair as well, you will only be able to bend your surgically involved knee to approximately 90 degrees during this initial period, which your physical therapist will confirm and assist with. When walking early on, you should use crutches underneath both of your arms. Work with your physical therapist to ensure that the crutches are the correct height, not only underneath your armpit region, but that the height of the handholds is also appropriate. When walking, both crutches should have equal weight placed on them as your surgical leg is advanced forward. This ensures that your knee has an adequate amount of stability provided by the crutches. In most cases, you will start physical therapy the day after surgery, but your surgeon may prefer that you wait until closer to 2 weeks after surgery to begin physical therapy. The therapist will help with moving your knee, ankle, and hip within the given limits based on the specific surgery that was performed. You will likely be in physical therapy 2 times per week for the first 6 weeks. The physical therapist will consider the type of health insurance you have so that your time in physical therapy can work best for you. The goal initially is to get full, pain-free knee range of motion, improved quadricep activation, a reduction in pain, and ultimately an improved capability to walk on your own, pain-free. It might take up to 6 months to fully regain your ability to move and do things like you did prior to surgery, and at least 9 months to return to higher level athletic activities. You should contact your surgeon if something doesn't feel right. Now, I'll hand it back to my colleague, John, to discuss what you should do if you have any issues after surgery.
Thanks, Dave. It's important to contact your surgeon if something doesn't feel right. While rare, should you have any symptoms that include a fever, which is defined as 100.5 degrees Fahrenheit or greater, or symptoms such as abnormal green or yellow-like fluid or discharge from the incisions or red streaking from the incisions itself, please contact your doctor's office immediately. Also, if you have symptoms that include your calf on your surgical leg that is significantly hot, red, and swelling, this may be a sign of a deep vein thrombosis, better known as a blood clot. Please contact your doctor's office immediately. If after hours, please call Riverside Nurse, a free service available to you 24 hours a day, 7 days a week at 1-757-595-6363 or toll free at 1-800-675-6368. Thanks for watching and learning about ACL surgery, recovery, and physical therapy at Riverside.
If you have any more questions, please contact us using the information provided here.